thank you guys for coming in today. We are so happy to have you. My name is Catherine. It's nice to meet you too. And you're Celia,
Yep.
Is that right? And Maddie. So what brings you in today? What are your biggest concerns, Maddie?
My gap.
Okay. So when do you notice your gap the most? Is it when you smile, or is it in pictures?
Yeah.
Just in everyday? Okay.
Yeah, she tends not to smile.
Okay.
Show her pretty smile when she's
Yeah.
in pictures.
You do have a pretty smile. What do you want from us? Do you want just the beautiful smile, just to show all of your friends and just be happy about it?
Yeah.
Okay. So it's mainly just that one tooth. I mean, your gap in between the.
And then like my lower.
Okay.
I have like a square kind of.
Okay.
Mhm.
In your lower teeth.
Yeah.
Okay. Do you have a hard time cleaning your teeth at all?
No.
No. Okay. Good. Do you ever have clicking or popping in your jaw joints?
Mhm.
Good. Have you noticed any crowding? You said that you do have the gap. Do you have any crowding where your teeth are overlapping or
Teeth right there. Along the bottom.
Okay, so in the bottom. Okay. Have you noticed your teeth being worn down at all? Like do you grind your teeth or do you clench your teeth at night?
Not really.
Okay. And has the dentist said anything about gingival recession at all? Or your gums come away from your teeth?
No.
No? Okay. And this is probably the weirdest question. Have you noticed any facial asymmetries or where your chin is crooked, like it goes to one way or the other? Okay. That's just fine. All right, so what we are gonna do today, we're gonna do a few things. We are gonna go and get some x-rays first. We'll come back in here and we'll take pictures, and then we'll have the doctor come in. He'll do a full examination and he will just tilt you back in the chair, just make sure that everything is okay and see what we need to do. We'll talk about treatment and then I'll talk about finances afterwards. Is that all right?
All right. sounds
Excited? We're excited to have you. Perfect.
Hey, hello, hi, David McDonough.
good. Hi, Celia.
Celia,
Yes.
nice to meet you.
Meet
This
you.
must be Maddie. Maddie, nice to meet you. I'm excited for this. Good. So Maddie, I understand you don't like that space between your two front teeth.
No.
All right, well let's take a look at it real closely. All right, let's bring you back and take a look real quick. I understand you don't like that space between your two front teeth.
No.
We don't like it either. Let's look at that, huh? See what we can do. Good. So Celia, do you have anything else that's concerning to you about Maddie's teeth?
You probably can already see, but the gun there, the little crowding.
I see that. Good. Let's take a look at that. What we'll do is a thorough examination. I'm going to start kind of from the outside and work my way in. I'm going to start with your jaw joints and make sure that we're not missing anything. I'll mention what I see and have Catherine take some notes for us as well, okay, Maddie. So the space between your two front teeth, that lower crowding down there, we're going to look at those specifically. Good. Go ahead and start with your jaw joints. I'll have you open real big. Great. And bite down. Wonderful. And open real big. Good. And bite down. So we have a little bit of clicking in those jaw joints, but you say they don't bother you. Good. And a little bit of mild facial asymmetry. Doesn't affect Maddie's good looks at all, so we're not worried about that. It's to the lower jaw to the right. Open real big for me. Great. We have a full adult dentition, including second molars. Wonderful. And bite down. Maddie has a class 1 malocclusion, which is a deep overbite with lower anterior crowding and upper spacing, especially between those upper ones. She has excess overjet. Her upper midline is coincident with her facial midline, and that lower midline is to her right, following her beautiful jaw. Open real big again, Maddie. All right, I can see this crowding down here, and I see this spacing. I notice that your upper lateral sides are a little bit small as well. That shouldn't pose a problem though. Go ahead and bite down again. Great. Well, let's discuss this a little bit. Let me sit you up. I want to show you a few things that I noticed in your examination. I want to make sure that we're on the same page. So as I look at your panoramic x-ray here, everything looks great. I have no concerns there at all. The roots are long, your bone looks great and healthy. As we move to the next x-ray, that shows us how your jaws grow, and everything looks really nice there. You're a good grower, good job. As we look at your posterior bite, that's the bite in the back. Your teeth are locked together beautifully on both sides, so I'm not overly concerned about your bite. Now the areas that we're all concerned about is of course this space between these upper front teeth and the crowding on those lowers. You can see a different angle on those lowers. You can see that crowding there. Now as we look back here, another thing I wanted to point out is how much vertical overlap you have between your front teeth. Your top teeth and your bottom teeth overlap one another a little bit too much, so that's something we want to address to ensure that your lower jaw grows normally and that your teeth will function appropriately in the future. So what are we going to do to fix all of this? What we need to do is we need to address everything with full braces. Braces on the top and on the bottom. You wear a little bit of elastics. Treatment time will probably take us about 18 months. We'll shoot for less if we can. Sound good?
Mm-hmm.
All right, you're going to have a great smile when we're done. And that's the truth.